So, officially, welcome from the Women's City Club of Greater Cincinnati, a 94-year-old civic organization dedicated to putting on forums just like this to educate the public on important civic matters of the day. Also, we are sponsored by Cincinnati Now, a national organization for women, celebrating its 40th anniversary this year, and the Cincinnati Women's Political Caucus, 38 years old and still growing strong too. And as I've explained before, as we do in all of our forums, we send out cards for you to fill out your questions. We're getting a lot of them already, and Stephanie and Ruth and Susan and Margie are our pickup people. If you haven't gotten your cards, your questions in already, they're being sorted, and they will be, as I said before, we will try to get to all of them because that's why we're sorting them by subject matter. And if we don't, all of them will go to Congressman Driehaus when we're finished. And of course, as I said before, the reason we do this is to keep everything efficient and get as many answered as possible. Now then, there is an elephant in the room. Word has been spreading through the internet that some people may be here tonight intent on disrupting this forum. I wouldn't think that of civil Cincinnatians, but you never know. And listen, folks, there's no secrets on the internet. Once it's on the internet, the world knows about it. So I will tell you that McGuffey, the Teabag Patriots, has put out directives that say, partly, I'm only going to use a few of the words, be disruptive early and often. You need to block the vote early. Watch for an opportunity to challenge the rep statements early. Try to rattle him. Yeah? I don't think so. Not have an intelligent debate. Now that's an insult to your intelligence. The goal is to rattle him, get him off his prepared script and agenda, and say something outrageous. Well, folks, if any of you have such a rude and childish idea in the back of your heads, I would strongly suggest you think twice. Let me give you fair warning. We're not going to use strippers of any sort. And we are here to get information and to answer your questions. And I'm glad to see that so many of you have put your questions on the cards as I asked you to. Now then, you came to hear Congressman Driehaus, not me. Therefore, you're going to hear Congressman Driehaus. Please welcome our representative in the 1st Congressional District, Stephen Driehaus.
Thank you very much, and if you want to disrupt my prepared remarks, I hate to disappoint you because I don't have any. But seriously, I know that there are folks that are part of the Tea Party group here, and I welcome you, and I welcome them to my office. And I know there are others in the crowd that would like a single-payer system on health care. There are some that want no changes at all, and I get that. What I'm here to do is to explain to you, to the best of my ability, what's going on right now in Congress with regard to the health care plan. But also, I'm here to hear from you because, I asked the Speaker, and a bunch of moderate Democrats asked the Speaker, not to have a vote this past week. I would have voted no had the bill come before us this past week. That doesn't mean I don't believe that there are things that are very broken with our healthcare system. some of these things and some of the things that Congress is trying to address. So with that, let me explain to you kind of the arcane process of the Congress. Currently, the bill, first of all, despite the fact that we have had months and months of meetings and discussions and hearings about health care, the bill itself wasn't introduced until about 2.5 weeks ago, which is one of the reasons that I objected. Because while I think all of us have time to read the bill in Washington, that doesn't necessarily mean that all of the small businesses and the doctors and the hospitals and the families back home have enough time to absorb it and react. And so I wanted this month to allow for that, and that's what I'm doing. The bill, because of the nature of Congress, it works like this. If the bill contains various things, it falls under different jurisdictions, and therefore the bill is referred to different committees. So we have the bill being discussed in 3 separate committees, and at this point, all 3 committees have reported the bill out in the House, but with different versions. If you've ever heard a markup referred to, a markup is simply the amendment process. So Education and Labor passed their version of the bill, and Ways and Means passed their version of the bill because there's a pay-for component in this, and if there's a pay-for component, it's got to come out of Ways and Means. And then most recently, Energy and Commerce passed their version of the bill on Friday. Now, you've got this whole other body in the Senate that is doing something different. And the challenge in Congress, if we are to have a bill at all, is to, first of all, in the House, reconcile the differences between the 3 committees and bring a bill to the floor and pass the bill on the floor. And then if they pass something in the Senate, to reconcile the 2, the House and the Senate, and that's done in conference. Thus, the speakers wanted to move this through as quickly as possible so that they could get to conference. Now, some of us said, let's just slow down. And I'll give you the political arguments. The political argument is, if you move something through right now, and you get it through before we go on break, you pass it. You pass something in the Senate, and you can spend the rest of the fall at conference and get a bill. Now, the other side, and the reason they want to do that is because they fear that if you take the month of August, people will poke so many holes in the bill that there's not a single representative that will want to come back and vote on any version of this. I feel differently. I wanted the month, as I explained, to come back and talk to folks, talk to my constituents about what was in the bill, and to hear from you, and to work on changes if those changes are necessary in the legislation. So that's where we are. We're trying to address what I believe are some very real difficulties. First of all, we have over 40 million Americans without any insurance at all. That costs all of us. It costs all of us that are insured. It costs us through our premiums because those individuals, they're still getting health care, but they're getting health care in the emergency. And when hospitals have to compensate for that care, they compensate it through those that can pay for it. And those that can pay for it have to pay higher premiums. So we are paying for it, don't get me wrong. We're paying for the uninsured. But we also have some other very serious problems. We have people that are denied care because of pre-existing conditions. We have people, even if you have insurance, who get very sick. And raise your hand if you've ever been to a fundraiser for a family because they can't afford to pay the health care bills. Go ahead, raise your hands. I thought there were more compassionate people in this room, but that's fine, raise your hands. But the fact of the matter is, we all know somebody. We all know somebody who's been in that situation. I'm serious. You know, if you have a kid or you have a spouse and they get really sick, God forbid, oftentimes your insurance will run out well before the bills are covered.